Welcome, everyone. Thank you for joining us today for MVC's Health and Action Workgroup presentation. My name is Rachel. I'm one of the site engagement coordinators with MVC. It is my pleasure to be facilitating the workgroup for you today. Here is our agenda for this work group. We will start out by going over some of our normal housekeeping and P4P credit reminders, followed by the presentation by Hurley Food Farmacy. And then following the presentation, we'll have a little bit of time to have a discussion or answer any questions you all might have. And then following that, we will go over some of our MVC upcoming events and updates. So some of our housekeeping items, just a reminder that we do record the work group. So if you can please keep your microphone muted during the presentation, unless you have a question. If you have a question, use the hand raising tool in the Zoom toolbar. But we will also have time at the end, or you can put your questions in the chat. And then let's see, I think I kind of covered everything there. We'll be monitoring the chat throughout the presentation as well, and we'll go through and help facilitate asking your questions from there. So feel free to put those in as the presentation goes. For our P4P participating sites, just a reminder that active participation is required. So that means answering any discussion questions and trying to participate, either sharing things that you've done at your site or asking questions is great. And then at the end of the work group, we will be sharing a link for the post-work group survey. This is a requirement for our P4P sites to fill out and send back in to us to get the engagement points. This survey is also great for anybody, even if you're not a P4P site, to provide feedback for us on how the work group went, what you liked, what you think might be a good improvement. We really appreciate any feedback we can get from you guys. Today's presenter is Amanda Escalera-Torres from Hurley Medical Center, the Food Farmacy program. Amanda is a registered dietitian and the program director for Hurley Food Farmacy. After finishing her bachelor's degree at Barry University in Miami, Florida, she completed her master's of public health in nutritional sciences at the University of Michigan in Ann Arbor. Amanda acquired program management experience by working for Washtenaw Intermediate School District and United Dairy Industry of Michigan on nutrition education and nutrition outreach projects. These experiences allowed her to learn about agriculture, sustainable food systems, and nutrition security, and how she now focuses on applying this learning to increase food and nutrition access for communities in the greater Flint area. Outside of work, Amanda enjoys spending time in nature, walking her dog, and trying new recipes, I believe, and traveling. All right, and with that, I will be passing this over to Amanda for her presentation.
All right, hello everybody. I'm so glad to be here with you today and thank you for joining. Speaking of nature, it is a beautiful day in Michigan, beautiful fall day. So I'm just really grateful to be here and grateful that I get to spend the next about like an hour or so with you talking about the program. So we can go on to the next slide. Hurley Food Farmacy was founded in 2017 as a response to the relatively higher food insecurity rate in Genesee County, which for 2023 was 13% compared to 11% in the state of Michigan as a whole. So a little bit higher in Genesee County overall. As part of our mission, clinical excellence and service to people, we made the commitment to address social determinants of health, especially food insecurity and health literacy. In 2020, we moved to our current location where we share a building with other essential outpatient services like Hurley Urgent Care and Hurley Diabetes Center, while still remaining accessible to patients as our location is easily reachable by bus route. And this is how we look like in the present day, operating as a food as medicine program under Hurley Medical Center. Hurley Medical Center, just to give you like a little bit of background of how our operations run, provides the salary and benefits for a full-time registered dietitian, nutritionist, and program director, which is me, as well as the rent and overhead for the facility we operate out of. All other expenses, including a part-time program assistant, are covered by grants, the majority of which are used to purchase food that meet the higher nutritional requirements of chronic diseases. Thanks to the grant support of many community organizations and institutions that I've laid out in this slide, and there are too many to name out right now, but thanks to this, Hurley Food Pharmacy has been able to operate without interruption for 8 years. The grants administration team at Hurley Foundation takes the lead on facilitating grant applications for us, but we really owe it all to the continued support of our partner organizations that have made this mission and vision possible. And if any of you are in this call, I would just like to personally thank you for the continued support and resources and all you have done for us. So talking a little bit about the people that we serve. So patients are eligible to come to the Hurley Food Pharmacy if they are both food insecure and have a chronic diet-related condition. So a chronic diet-related condition would include diabetes, high blood pressure or hypertension, high cholesterol, heart disease, kidney disease, and any others. This is intentional because there's a well-established link between food insecurity and the prevalence of chronic diseases. As we can see in the chart, as food insecurity decreases, the prevalence of chronic disease increases. This is due to many reasons, other than the fact that not having a basic need such as nutritious food is stressful and can promote inflammation in the body, leading to the exacerbation of these diseases. But medical interventions such as drug prescriptions don't work as well without a proper diet. So, for example, for patients who have high blood pressure or hypertension, these patients, a lot of them are on diuretics, which deplete essential electrolytes and nutrients such as potassium, magnesium, sodium, calcium, zinc, and several B vitamins. And not having a proper diet while on these medications puts patients at risk for worse health outcomes. So actually having a food as medicine program in your hospital or clinic is making sure that the quality of care you deliver is thorough and all-encompassing. So our patients are referred to us either by Hurley Medical Center inpatient or outpatient services or community clinics and primary care providers around Genesee County. If they are coming from Hurley, staff conduct the social determinants of health screening when patients are seen at the hospital or clinics, which consists of the hunger vital sign questions provided by the USDA. And these read as, within the past 12 months, the food we bought just didn't last, and we didn't have money to get more. And within the past 12 months, we worried whether our food would run out before we had money to buy more. So if patients answer often true or sometimes true to either of these questions, they would be flagged for food insecurity. As mentioned, the other referral source is community clinics and primary care providers across Genesee County. So we have about a network of, I would say, like 12 partners that actively refer patients to us from their community clinic or primary care practice. Their staff uses a screening form that we provided them that is a little bit more extensive, and you can see it a little bit here. The screening form has the hunger vital sign questions as well as the qualifying chronic diet related conditions the patient has to have to qualify for the program. But it also has additional questions on their ability to cook at home and stay compliant with the program. This is all done with the intention that both staff and patients understand our program and what they're being signed up for a little bit better, because we want to make sure that they are successful with the program and that they're making the most out of the resources that they're getting. So regardless of the screening tool that they use, patients receive a referral form that explains the program, and this is how it looks like. And they also, on their have the next steps they should take to sign up and come in to receive food and nutrition education. So basically, patients call in and they're scheduled for their first visit. During that first visit, they get to attend a nutrition education group class with me. And they also get their groceries. And then after that, they would be officially enrolled in the program and can walk in for their remaining 5 visits. So patients get to come to us once a month for 6 months, and at each visit, they receive about a week's worth of food for them and their whole household. So this would be about like maybe 12 to 14 meals for them and their whole household. So we serve households from 1 person to up to 6 person households. We offer the food in a way of a shopping list or menu that allows us to be 100% client choice. So this menu follows the Mediterranean style dietary pattern from the Dietary Guidelines for Americans, which allows us to integrate nutrition education into how patients choose their food because they get choices from different vegetable groups, grains, seafood, poultry, nuts in intentional amounts, while also allowing them choice, dignity, and accommodating their preferences, which is really, really important when we're doing any type of food security work. On top of that, we also feature monthly meal kits with recipes that align with the nutritional needs for chronic diet related conditions like diabetes, high blood pressure, and high cholesterol. So we take the time to calculate the nutritional value of these recipes, making sure that they're appropriate for the patients that we serve. And they receive the pre-measured spices, condiments, and all the ingredients in one separate bag in order to be able to make the meal at home. So it's kind of like a Hello Fresh type kit thing. And so these recipes are meant to facilitate easy, quick, healthy meals that implement the nutrition education that the patients are receiving. So when they come in, right off the bat, they're getting nutrition education not only in class with me, but also in the way that the grocery haul is being offered to them, and also with the recipes so that they learn how to implement the stuff that they're learning, the food that they're getting into an actual application in their day-to-day lives. Hurley Food Farmacy has contracts with 11 farmers and vendors across Michigan. This is where our food comes from. Flint Fresh does also an amazing job at connecting us to local produce growers consistently throughout the year as well. This is really, really important to us because food, specifically produce, loses its nutrient value by 10% each day. And the average produce at the grocery store is about 14 days old, meaning that by the time it reaches consumers, it has had about 140% nutrient loss. So to really be able to use food as medicine, local sourcing is key. And our farmers across Flint, Genesee County, and beyond help us do that. Here are some of the vendors that we work with, and all of them just help us meet the dietary guidelines according to that Mediterranean dietary style pattern, but with local foods. So if you ask me as a registered dietitian, I think this is one of the coolest parts of my job, is that I get to support local agriculture, the local Michigan economy, and also make sure that my patients are getting the most nutritious food possible. This is how our inventory is looking like today. We've retired canned fruits and vegetables and are now able to offer a combination of local fresh and frozen produce, local fresh dairy, and local frozen meats. This is also a picture of us receiving fresh harvested greens from the Edible Flint farm, which is less than 10 minutes away from us. So it literally doesn't get any fresher than that. And I just want to say that we're really, really proud of the type of food that we've been able to bring in the last year and our offering. And we've gotten great feedback from patients. So this is how nutrition education looks like at the food pharmacy. It can either happen in the form of group classes or one-on-ones with me. Basically, we have a great time, as you can see in the pictures. All of the nutrition education is geared towards the actual application and implementation of nutrition principles in patients' daily lives. So we really focus on topics like meal planning, meal timing, recipes, food tasting, and self-monitoring when we're together, so that when they go home or when they graduate the program, they have like a toolkit that they can use. And hopefully these are habits and practices that they'll continue to implement in their daily lives. So we offer classes for kids as young as 5, all the way through older adults and seniors. Here, kids with patients, we're learning how to make yogurt parfaits. You can kind of see that in the picture on the top left. And they were learning about how to make their own yogurt parfait and the importance of protein. In another class, they even learned how to make apple chips and peanut butter yogurt dip, and they got to shop their own apples using kid-friendly knives, and they really loved that. So anything that includes their participation in in food preparation in the household, kids love it, and it's very recommended from early on to ensure that kids have a healthier diet as they grow up. So we do that as well. In one of our classes, patients got blood glucose monitors to support self-management at home. And for those patients who cannot make it to class, we distribute nutrition newsletters, so they always receive like some sort of nutrition education, whether it's face-to-face in group class, one-on-one with me, or print literature to read on their own time. Additionally to that, since the root of a lot of people's food insecurity is not only food access, it's also just plain financial instability. We do take the time to triage patients to public health resources across Flint and Genesee County. So a lot of people always ask me what happens after patients complete their 6 visits and graduate the program. So we really take the time to refer them to these resources by giving them a folder with a list of organizations and contact information to receive help paying prescription bills, utility bills, finding employment, low-cost childcare, and other resources. They also get a monthly calendar that has all the food distributions happening around Greater Flint in case they need more groceries during the program, since we are supplemental and we're only giving them a week's worth of food per month, or after they finish the program, if they're still facing food insecurity, so that they have some resources to lean on and we're not sending them home with empty hands. So this is a really, really important part of our work. Apart from giving them the folder, we're constantly checking in with patients, making sure that they are doing well at home, and encouraging them to also talk to their other providers about the situation that they are going in at home if they need more help or anything like that. In terms of program and participant success, Hurley Food Farmacy has had wins behind the scenes and with the patients that we serve. In the last year, we were able to establish 11 contracts with local farmers and vendors, which is really important to us because for every $1 spent on local food, around $1.32 to $1.90 is generated in additional economic activity for Michigan. Also in the last year, we've been able to continue and enhance 12 referral partnerships with community health clinics and primary care providers. So those are the ones that I mentioned earlier, for example, Genesee's Hurley Cancer Institute, Hamilton Community Healthcare Network, Michigan Health Specialists, Wellness Services, and many more. And this helps us expand our healthcare safety net in Flint and Genesee County to reach as many patients as possible. We constantly communicate with their office managers, making sure that they understand what the program offers to them, also making sure that we're sharing those public health resources that I just talked about too, with them as well, in case patients go to them and they don't have any of these resources to give them to. So we really focus on kind of enhancing that healthcare safety net that we offer patients in Flint and Genesee County by making sure that we're building relationships with our community of providers and clinics around us. Over the last year, we've also served over 5,500 individuals from ages 0 to 60 plus, including patients with diabetes, hypertension, high cholesterol, cancer, and kidney disease. And finally, out of all patients who completed 6+ visits at the food pharmacy in the last year, or in other words, graduated the program, only 5% of them had inpatient admissions. So this suggests that there is a correlation between healthy food access, healthy eating, and inpatient admissions and health outcomes. So in terms of future plans at Hurley, we're working toward reopening the Hurley Garden, which has been dormant since 2018. With the help of Edible Flint, which is a community partner in food access in Michigan, and they also have in Flint, Michigan, sorry, and they also have an educational farm. We hope to grow produce for the food pharmacy and also incorporate the garden as part of our nutrition education for patients so that they can make the connection between soil health and human health. We also hope to serve as an enrichment space for patients who are admitted long-term at the hospital, as we know that gardening, sunlight, and fresh air can contribute to mental health and positive health outcomes. So we're really, really excited about reopening the garden. We hope to have a full harvest by next year. So we are actually going to plant garlic in a few weeks. So we're really, really excited about how it's shaping up and how we've been able to leverage partnerships with other community organizations to make this happen. Another exciting thing that has been happening is that we were awarded the Capacity Connect Initiative grant from MDHHS, which we will use to set up the food pharmacy to become reimbursable by Medicaid health plans by next year. So up until this point, the food pharmacy, how I shared earlier, has operated out of grants. We've made no profit for our services. So I think this is a really, really good tool that we can use to make sure that this program stays sustainable. And we're really excited about it. We're literally in the midst of establishing and developing business practices to help us do this and assessing our capacity to see how we can start billing, how we can start following up on getting more referral partners, how will this look like, and how we can also start tracking more health outcomes and kind of like more of the overall impact that the program has, not just on patients, but in the healthcare system as a whole. So we're really, really excited about this work, and we were really lucky to get that grant from MDHHS. I should also say that we're doing this work with MSU Public Health, so they're giving us a lot of insight and expertise. And yeah, we're just really excited, and we've been working a lot behind the scenes to make this happen. And that's all I have, and I would like to take questions now.
All right, thanks, Amanda. All right, folks, if you have a question, you can feel free to put it in the chat, or you can use the hand raising tool. While we wait for that, I guess I will use my question for you, Amanda. If a hospital wants to pursue a program like this, what would you recommend that their first steps be?
Great question. We talked about that a few weeks ago at the Food is Medicine Summit, and we basically came up with the following roadmap. So I definitely recommend conducting a needs assessment first, getting to know your community, getting to know the specific needs that there are out there. There are food as medicine interventions. So there's produce prescriptions, they are healthy food packs, there's medically tailored meals and home delivered meals. So getting to know your population and getting to know their needs and what is most appropriate to them will help you make sure that you set up a food as medicine intervention that's going to be really effective for them. The second thing would be securing your funding, whether that is going to be through grants, donations, um, health insurance reimbursements, right? So thinking about how that's going to look like for you. The third thing would be looping in your key partners and stakeholders, right? So I always like to put registered dietitians out there. We are a great tool for these kinds of interventions and programs in the community. But really anyone that addresses social determinants of health in your community is a key stakeholder for you. So looping them in, asking them questions, seeing how you can work together, that's going to be really important. And then the other thing is all of the non-glamorous things that honestly I love to do, but I will admit they're not glamorous at times. So making schedules, your logistics, your operations, your operating hours, your um, additional staff that you may need in order to make this happen, figuring all of that out, making sure that you market your program, making sure that you really have that healthcare safety net, how I talked about last time. That's going to be key in making sure that your program is successful, that the word gets out there, and that you reach as many patients as possible so that you can change the world and do what you got to do.
Awesome. Thanks, Amanda. It looks like we have a couple questions now in the chat. Jordan asked, during the non-growing season, do you have difficulty getting enough fresh produce from your vendors?
Absolutely. That is one of the things that we struggled with in the last year. But now that we have that contract with Great Lakes Farm to Freezer, we're actually able to get frozen produce from Michigan that was harvested at peak ripeness and frozen to retain all of those nutrients. And we're able to use that throughout the colder months now when we're not going to have as much fresh produce. And it's still a really nutritional food. So we found that by freezing produce, sometimes you get higher vitamin C and higher amounts of other vitamins. So it's a really great alternative that we were able to establish that contract with them and able to offer this to our patients now.
Awesome. Thank you. Cody asked, do you use the existing community health needs assessment data along with other health systems SDOH data to help identify areas of need?
Yes, absolutely. So, as we are part of a bigger organization like Hurley Medical Center, they are the ones looking at all of this ACOH data, community needs assessments. We have a great community health um, person on our side. Her name is Ternisa Martin, or Nurse T, and she is in charge of of using all this data and informing us with what types of interventions our community needs at any point. So we're constantly monitoring this and making sure that we're hitting all the targets, whether that be via the food pharmacy or other programs at Hurley Medical Center.
Awesome. Thank you. Carter has a question. The program sounds awesome. I think I missed it when you discussed this, but do all patients um, who typically get referred, can patients come in on their own? If all are referrals, do you find it difficult to manage so many of them?
Okay, so to answer that question, so patients must be referred from a provider. It could also be a community health worker as part of a community health clinic or something like that, but it definitely has to come from um, a different provider because this is kind of like a prescription. So even though we're using food, it's food as medicine, so it's a prescription. So they cannot just like self-refer. We are discussing that at the moment and seeing how we can continue to make the program more accessible while making sure that we stay compliant. And then to answer the second part of your question, we are currently at capacity. We serve around, I would say, around 300 to 400 people a month. And with our current operating hours, we're currently at capacity for how much people we can serve, but I think we're handling it pretty well right now. If that were to increase, then we would definitely have to plan and see how we can meet those needs.
All right, great. Thank you. It looks like our questions have slowed down in the chat. If
But
anybody,
I have a
oh,
question.
oh, great.
My question's actually for Amanda and anyone else on the call. I am looking through our list of attendees. I know some folks are near or close to Genesee County, and I would venture a guess that they may not have even known that this program existed. And that makes me think, are there other programs across the state that you're aware of in other communities? Or if anybody on the call knows of a program within their community that has a similar type of setup. Could you just share that? Because we have people from all over the state on here who would, I'm sure, love to see this in their community.
Yes, absolutely. So there is the Producing Change Food Pharmacy at U of M, Sparrow and Lansing. They actually visited us last year before they launched, and they got an overview of our operations. We compared notes, and we're all the three programs are really close. So the other program too is Fresh Food Pharmacy at Grace Health in Battle Creek. So the three of us are pretty close. We're all clinically integrated food as medicine programs, and we're constantly sharing best practices and talking about how to better serve our patients. So yeah, we have those three so far. There's also actually the farm at Trinity Health in Ann Arbor. And I do think they have locations in Oakland, and I think I'm missing another one of them, but they're also doing produce prescriptions and healthy food packs.
I think we need it across the whole state, for sure, the whole country.
Yes, absolutely.
It looks like we do have another couple questions that popped up from Kijana. Thanks for the great presentation. What an amazing program. I'd love to know what are the main chronic conditions that are being reported by users and their household. Is there any delivery or pickup options for users?
Yeah, great question. So off the top of my head, from the data that we've looked at in the past year, the patients that we most serve are patients with high blood pressure, followed by diabetes, and then high cholesterol and heart disease. And yeah, so patients, if they're not able to come by themselves, patients can always assign a proxy to pick up for them. We also work with patients in many ways. So if patients need to just pick up the food and go, we usually call them ahead of time, take their order, have it ready for them when they're picking up. There was also a time I think we ended it in May of this year. That we were partnering with Project Dash by DoorDash to deliver the groceries to patients, and that was really, really cool. We did run out of the funds to do that. And so, to kind of emphasize the importance of us getting those ILOS reimbursements that I talked about in the last slide, that's part of the reason we really want to continue to expand accessibility to patients, make sure that we're meeting them where they're at, right? So a lot of these patients, again, with the financial instability, they don't have money for gas. They don't have money to, necessarily be driving around town, going to their doctor's appointments, and then picking up food from us. So we do understand that, and we're very cognizant of that. So we're trying to work to see how we can leverage more funding towards making sure our program remains accessible.
Great, thank you. Julia asks, with the government shutdown and now recently Michigan SNAP benefits being impacted, do you anticipate calls for help from more providers? If so, are you preparing in any sort of way?
Yes. So we do anticipate participation will increase when SNAP benefits and Medicaid is cut. And at the extent that it will be cut, throughout the next years, it's kind of uncertain. There's a lot of uncertainty in the space. We were lucky that our grants and our funding weren't as impacted as other organizations by the cuts, but we do have that in mind. We do have that we're planning to make sure that when that does happen, again, all we're looking at the sustainability of the program because we really do want to keep serving people. But we do expect it to increase. So that's why we're doing all our planning now, making sure we're increasing capacity, increasing infrastructure, increasing the staffing that we have available, seeing how we can get our all inventory turnover to make sense so that we can continue to serve patients. It's a lot of moving parts, I would say, into making this happen, but we're thinking about all of it and we're really aware of the current situation.
Great, thank you. All right. Anybody else have any other questions? Looks like it's kind of calmed down. Okay, I'm going to go ahead and move us forward now into some of our MVC updates. Okay, so some of our upcoming work groups that we have left in the year 2025. November 4th, we will have a rural health work group. We'll have a presentation from Hillsdale Hospital on their new mobile health clinic that they have started implementing. And then on November 20th, we'll have a post-discharge follow-up work group. And this one's going to be a presentation by our own Jana Stewart with MVC and a fellow CQI HBOM. So stay tuned for that. We'll be sending out emails with information on the topics for that November 20th one soon. And then in December, we have a pre-op testing work group on Tuesday the 2nd. And last one of the year, Health and Action Work Group on December 18th. So yeah, you can still register for those. Our 2026 engagement calendar is up on the website, so you can look at dates there for our 2026 work groups starting in January. Some of our upcoming events, MVC is hosting a networking dinner for rural hospital members that will be attending the Michigan Conference for Rural Health for Critical Access Hospitals on November 6th. The networking dinner is that night on the 6th, so the registration link will be on the slides. I'll also include that in the email that gets sent out. So if you're from a rural hospital or critical access hospital and you will be going to the conference, please feel free to join us. And then the Michigan Cardiac Rehab Fall Meeting is going to be on November 13th. MVC is collaborating with them and hosting this event. So if you have a lot of cardiac rehab involvement, you might be interested in joining them. Registration link will be on the slides and also in the follow-up email. And then if you are interested in presenting this coming year, 2026, we are now asking for presenters to submit any proposals. The link for a presentation proposal will be on the slides and then also in the email. So we'd love to hear your ideas for what you'd like to share with our group. And that is it for today. Jessica's going to be putting the link for the post-work group survey in the chat. So please fill that out. And thank you so much, Amanda, for presenting today. It was wonderful learning about your program. We really appreciate it. And thank you, everybody else, for attending.
Yes, thank you, everyone.
Thank you. Great work, Amanda.